Okay, guys, now the fun part. We get to give the medication. This is super, super easy. So now we've drawn up our medication. We know what it's for. And now we're going to go ahead and give it to our client. So I've gone into Mr. Jones' room, and I'm going to give my IV morphine. I look at labeled my syringe that I needed to label. And then I've also got 2 syringes of normal saline so that I can give the medication and then flush before and after. All right? So what I'm going to do is I'm just going to show you how to do that. Now, if I'm taking care of a patient and I walk into the room and they don't have an IV infusing or anything like that, I'll just simply access their line. And if they have a green Kuros cap, they either come in green or they come in red, just depends on the facility that you're at. It's called a Kuros cap. And what that means is it's got a alcohol, well, it's a chlorhexidine solution on a little bitty cap that keeps this from getting contaminated. If your patient has that on, then you can go ahead and administer the medication. Now, if it doesn't have that on, you need to make sure that you have your alcohol preps with you at all times so that if that does happen, you wipe and scrub your hub for the 30 seconds. So let's pretend like we don't have a Kuros cap on, and we are going to go ahead and scrub our hub. Go ahead and get on there really all in those crevices and everything. It's very, very good because these have lots of crevices, and then get into the top part of it. You want to make sure that you get that really, really, really clean, guys. Okay. And then next, what we're going to do is always keep a hold of that. And keep a hold of it down here at the bottom so that you don't touch it or contaminate the top of that injection site. All right? And what I'm going to do is I'm going to do my 5 rights of medication administration. I've ID'd my client. They've told me their name and their date of birth, and I've told them what the medication is. So Mr. Jones, I'm going to be giving you your morphine, and your morphine is for pain. I'm going to give it IV push. It's going to take me a little while to give it because it's going to go over about 4 to 5 minutes so that I can keep the side effects at the most minimum. So tell your patient what you're giving them, because if this patient was allergic to morphine and we didn't know that, then they can tell us and go, oh wait, I'm allergic to morphine, and that can provide us with a near miss opportunity of giving a medication that they're allergic to. All right, so next thing you would do is you would take your normal saline syringe. It's the one I can't open. Get the air out of your syringe and then put that on by pushing down and twisting. You'll push that. All you have to do really is to flush with 3 mLs of normal saline just to clear out the line and make sure that it's actually not infiltrated, it's infusing well, so on and so forth. So you're just really checking the patency of the line when you're flushing that 3 mLs of normal saline in. And then after that, you'll continue to hold that and then take your next syringe, push and twist, and then give this over the desired amount of time. Now, I looked in my book. My book said over 4 to 5 minutes. Depending on your patient and their health status, depends on how fast you can give or not give the medication. All right. See how you got that little, I have a little air bubble? So go ahead and flick that. Get it to the very, very top because it always follows via gravity. And that's how I usually give mine, is by up like that. So if I do have an air bubble, it's going to be always at the top, and I don't give that to my patient. And then we're going to give this slowly over 4 to 5 minutes. And it's just a slow, constant push. And then as you're giving the medication, you're assessing your patient at all time while giving the medication. So now, our 4 minutes is almost done. And now we're done. Now we just have to flush the rest of the medication in. A lot of times we don't think about this, okay? And we just go ahead and just flush 3 mLs real quickly. But remember, there is still morphine from here all the way to there. So flush that 3 mLs very slowly over about 1 minute. All right? Then that prevents you from giving that last part of that medication at a fast rate. So we'll give that slowly over the next minute. And then once we're done with that minute, then you go ahead and you take your syringe off. And then this will then need a new Kuros cap. These green caps are only good, or the orange caps are only good for one-time use. Now, if I have to walk across the room, that doesn't mean I have to hold this anymore. I can go ahead and set that down, go get my Kuros cap, walk over to my patient, and put that on. Because this, guys, is what makes it clean. All right. And then you'll just tell your patient that you could get a little drowsy, groggy, explain to them the side effects of the drug, and then if they need help with their safety, make sure that they give their call light to them, and you tell them to call you if they need to get up. So that's it. That's the how to do an IV push. Pretty simple procedure.